27-year-old male, investigation for headache, neural examination normal. This is his CT scan, and we can see here on the left, we have an area of hyperdensity over the frontobasal region, and here over the right is rather large hyperdensity region with the probably small calcifications. And here is his MRI. We can see this image over the left frontobasal region with this very suggestive of AVM. So we can see here, we can see a vein running laterally and anteriorly at the anterolateral part of AVM. And we can see here, probably over the temporal region, we can see a vein running forward towards the tip of a temporal lobe. And also we can see that the AVM extend upwards all the way to the almost to the head of caudate nucleus over here. Coronal cut of his MRI, we can see the carotid artery here, the left carotid artery. We can see the A1, M1 should be running this way, and we can see this AVM involving the area right above the A1, M1 carotid bifurcation, and we can see that this is a vein dilation here. Here on the right, we can see the vein running at the superior part of the AVM. We can see that Sylvian fissure, there are dilated veins here. And there's another vein running downwards. And here at a more anterior cut, we can see that there's another vein over here. So this is an AVM occupying the frontobasal region, extending upwards all the way to the beginning of basal ganglia. You can see here is lentiform nucleus, and this is a head of caudate here, and the AVM is extended all the way to here. But we can see there's a space, probably CSS space, white space, maybe separating the AVM from the rest of the brain. And once again, there's a draining vein on top of the very anterior part of the AVM. Here we have the sagittal cut, and in this cut we can see that there's a vein, large draining vein at the posterior inferior part of the AVM. We can see another cut here, another draining vein running downwards here, another draining vein running forward, and then here we can see the nidus of the AVM, the vein running at the posterior inferior part of the AVM here, and this is another cut, and this is optic nerve. So you can see part of the AVM right on top, above the optic nerve. This is his angiography. Left internal carotid artery. Here we can see the cervical, petrosal, cavernous, then supraclinoid. We can see here the anterocerebral artery, M1. This is at the genu, so we can see the AVM in this area. We must be supplied by branches of A1, anterocerebral artery, by M1, and by maybe branches from the bifurcation of the carotid artery on the left side. And here we can see a later arterial phase with the filling of the AVM, and we can see a little bit of a draining vein over here. And this is a late arterial phase an early venous phase we can see here, and we can see some veins running downwards. We can see a vein running towards probably the sylvian fissure here, and another vein running on top. And this is going definitely to the anteriorly and to the temporal lobe. This is the lateral view on the right and the AP view on the left. So once again, M1, A1, M1, feeling the nidus of the AVM. Here's the lateral view. You can see this is a sylvian triangle. Sylvian triangle. The posterior part of the AVM extends a little bit inside the sylvian triangle, and also maybe this part. But this is the frontobasal area. This is the ophthalmic artery. So this AVM occupies the frontal lobe above A1, M1, and carotid bifurcation. If we put the AP view side by side with the lateral projection, we can see that this is already a late arterial phase, early venous phase of the angiography. We can see this is a big vein over here. From this big vein, there's one vein running backwards to drain into the straight sinus. So this is a deep vein. Probably the basal vein is over here. There's another vein draining upwards. There are two veins running anteriorly, and from this big vein, there's going to be a vein running forward and then downward, forward, downward, and then laterally to run probably underneath the temporal lobe to join the transition between the transverse and sigmoid sinuses. So probably it's this one. This one is running this way and going to the transition between the transverse and sigmoid sinuses. This is a lateral view of the arterial phase of the angiography. You can see we already saw this angiography. Now compare with the late capillary phase or early venous phase. So we can see we already described this vein. Probably this is the basal vein, vein of Galen, straight sinus, another vein draining forward towards the superior sagittal sinus. This is the right in ICA angiography. We can see a little bit of a compartment that can be filled, supplied by the contralateral ICA. You can see here and you see the draining vein. This big part we saw is on the back part of the AVM, and then runs forward and downwards, and then it will drain towards the transverse transition between the transverse and the sigmoid sinuses. This is a lateral view of the venous phase of the angiography. We can see that the big vein, the main draining vein, is running on the posterior part of the AVM, and from this, and it will run like this. This patient underwent embolization of his AVM. So this is before the embolization. This is a lateral view before the embolization. So this is the final aspect of the AVM after the embolization. This is a lateral view. Let's start with this lateral view. You can see this is the AVM. And we can see that at least in this view, lateral view, approximately the anterior half has been embolized. And the remaining part is the posterior half of the AVM. If we go to the arterial face here, this is M1, MCA, this is intercerebral artery, this is carotid artery. We can see that the center, the core, and also maybe the lateral part is gone. The remaining part is the medial on the top, medial, and inferior part. So the anterolateral part of the AVM has been embolized. So this is just to remind us the original shape and the location of the AVM. So where is this AVM located? It's located in this area at the frontal orbital region and extending upwards, almost reaching at least part of the inferior part of the head of caudate nucleus. So this is the location of the AVM at the frontal orbital area. And what artery do we expect to supply this AVM? We're expecting these branches, cortical branches, not the branches from the lenticular striated arteries, the medial and the lateral. No. Our cortical branches that will go supply the AVM. Cortical branches from A1 and also from the M1. And maybe some branches from the, this is A1, M1, branches from the carotid bifurcation. So they should be supplying this AVM. So this patient will undergo a surgery. It's going to be an extended Soriano approach for this lesion. So this is the angiography, same angiography, but I have placed this angiography in supine patient in a supine position. So the tip of the frontal lobe is over here. The nose of the patient is over here. The neck is over here. The top of the head is over here. And this is posterior. So once again, anterior, superior, posterior, inferior. So we know that the anterolateral part of the AVM has been embolized. The remaining part is on the top, a little bit on the top, the posterior half of the AVM, and also maybe a little bit of basal part. And we know that there's a huge big vein over here at the back part of the AVM, and one big vein is running forwards and then downwards to join the surface of the temporal lobe, and then probably is running on the basal surface of temporal lobe to go to the transition between the sigmoid and the transverse sinuses. And from this, the back part of the AVM, there's going to be probably a basal vein draining towards the vein of Galen and straight sinus. And from this part, another one, but this is not a deep, this is superficial vein running backwards too. And there are two veins running forward at the anterior part of the AVM. So this is what we have to memorize, we have to keep in mind before going to the surgery. So this is a left extended Soriano approach. So here we have the left temporal lobe, left frontal lobe. We have the Sylvian fissure over here. And this is probably one of the draining veins exiting from the Sylvian fissure. From the back part of the AVM, we have another vein over here running on the surface. And we know that there will be two veins running forwards here at the frontal side. And there will be one deep vein, probably a basal vein, running from the back part of the AVM. So as a principle of the AVM surgery, you have to open the fissures, open the sulci to identify all the elements of the AVM before you attack it. So let's go to the video. Now he's opening the arachnoid. Sharp dissection using mostly knives. He has to open all the sylvian fissure. You see the embolization material, because you have to isolate, you have to see the M1, you have to see the carotid artery, you have to see the A1. This is another vein. This is artery. Embolization material, you can go and cut it because the vessel is already gone. Coagulation. As we remember, the anterolateral part of the AVM has been embolized. So he's finding a lots of embolization material right here. This is vein. Now he's looking at probably MCA, the middle cerebral artery. This one. Coagulating arterial branches going to the vein. This is another vein running on top of the MCA. Removing the embolization material. Now he has a better view of the middle cerebral artery. You see the branch going to the vein. It's following this artery branch of MCA. Following this, you see all the branches coming off the MCA, but it's going to the AVM is being cut, coagulated and cut. The lenticulostriate arteries is more inferiorly. Now this is a big vein. It's part of the big draining vein back here that would drain like this, go forward and then exit the sylvian fissure and go back to the transition between the transverse and sigmoid sinuses. So any arterial branch that is going to the AVM is coagulating and cutting, you see, going to the vein. This is MCA. Branches that are coming off the MCA and going to the vein or to the nidus, you have to cut it, coagulate and cut it. So he's following the M1. More embolization material because he is at the anterolateral part of the AVM. More embolization material, he coagulates and cut. Now he's working at the periphery, the superficial part of the AVM. This part has been embolized as well, so he's going into following the embolization material. Coagulation. This is olfactory tract. It's better to preserve it. So this is probably the part of rectus gyrus right on top of the olfactory tract. Now he's doing the circumferential coagulation and dissection of the AVM. This is anterolateral part of the AVM, the most superficial part of the anterolateral part of the AVM. So coagulation, we know that the main draining vein is over here, so he's hit this one. So he cannot cut or coagulate here, but he can do this circumferential. It's safe because the venous blood will be draining towards here, so it's safe to go around the AVM as long as you keep the main draining vein intact. Now he's following the embolization material. Anything that goes to the AVM will be coagulated. You can see there's not much bleeding at this stage. So he's following the interface between the brain, the white matter, and the embolization material. Still small branches can bleed. Circumferential coagulation. Now this is optic nerve, left optic nerve. He's working left optic nerve. He's working on the AVN that sits right above the left optic nerve. You see this embolization material. This is A1. You have to preserve the A1 and see and check where are the lenticular arteries. That's coming from the back wall of A1 and M1. So pulling out this small catheter. You see, this is A1, M1, carotid bifurcation. There is a arachnoidal plane, so he's following this arachnoidal plane. You see the main draining vein. As long as he's keeping this vein intact, he's working and following, staying above this arachnoidal plane. Below this arachnoidal plane probably would be the lenticular arteries, so don't enter that. And above this arachnoidal plane, there's going to be branches to the AVM. So continue to dissect, not to damage any lenticular striated artery. Coagulate and cut, preserve those branches, and preserving the draining vein. Now he's working on the anterior inferior surface of the AVM. Now he's working at the back side of the AVM. This part, the back side is less embolized, so we're expecting to have more bleeding at this stage, and he has to coagulate more because that back side of the AVM is not so embolized. Now he's making circumferential dissection following the embolization material and the interface between the brain. You can clearly see this interface, the brain and the AVM. Small branches from the this is the olfactory tract. He's trying to preserve it. This is the inferior part of the AVM, inferior and medial part of the AVM. You continue to do the circumferential, and now he's turning the AVM upside down to see the inferior part of AVM. You see, that's the part of AVM that is connected to that huge draining vein at the back of the AVM. And now the AVM is dead, so he's coagulating this draining vein and cutting it. Now the AVM has been removed. You can see this is carotid artery, A1, M1, left optic nerve, M1, A1, carotid artery. This is the final aspect of the resection. To remember those veins running here, that vein running forwards, and then they're all here, but the AVM is gone. Wonderful surgery. So this is his postoperative angiography showing the total removal of the AVM. This is the frontal view, here's the lateral view. And this patient remained neurologically intact after the surgery.